Good morning to our Thrive podcast. I'm Vivi Letri here at Zen Rocks with one of our favorite friends and guests, Dr. Samone Zarabi.
Yes.
Lovely to have you here again, Samone. And today we're going to talk about what it is to be healthy, medically, physically, spiritually, in every way, from the classical, medical, and modern point of view, and also from a holistic and natural point of view. Let's see how these two come together to help us understand how to best take care of ourselves. Welcome, good morning, and tell us about your specialty, which is lifestyle medicine, and it is a branch of medicine, right?
Yes,
Tell us.
exactly. First of all, thank you for having me here. It's an ideal place for my kind of lifestyle medicine, which is indeed a medical specialty. And it's, as you said, very holistic, looking at the whole picture, the whole human existence.
Wonderful. And the path that has brought you to this medicine and what is bringing us together is that both of us, we face life-threatening diseases and debilitating diseases. And I'll talk about my experience later. And your experience is that when you were in medical school, you got sick with cancer.
Yes.
And you overcame it. The first time you said it was when you were in university, medical school, and
I was a second-year medical student, and it was quite serious, but here we are, healthy and well today.
you overcame the cancer that people said you have a few days to live,
Yes.
right?
indeed.
Your doctor said you have a few days to live. You overcame it.
Yes.
It was a miracle.
It was a miracle, indeed.
And then you moved to United States from Greece. And to say a couple of words about Samone's background, she was born in Iran, raised in Sweden, went to school in Sweden, and then decided to move to Greece to come to medical school in Greece,
Yes.
falling in love with our beautiful country.
Indeed, true.
Then completed your specialty, your medical school in the United States, worked in the United States where you got married and had 2 kids, and you worked there and you got sick again.
Yes.
And that's when you discovered lifestyle medicine. Can you tell us about it?
So during my residency, I got really sick, and that sickness this time brought me to my knees, and it was very tough. So I had to, first of all, heal my own body because it was truly sick. But then my body was healed and I was healthy again, but something was missing. And that's when I started the journey of self-reflection, what's going on with my soul, my mind, what are my thoughts. And through this journey, I discovered lifestyle medicine, and here we are now.
You are in the United States and you are in the medical field. You're a mother of 2 and living with your husband and your family. You got seriously ill again, and due to formaldehyde
Yes.
intolerance that you were using in the lab, in the medical lab while you were working?
Yes. Formaldehyde is a preservative, and by the way, formaldehyde is everywhere. It's in your shampoos, in the wood, it's everywhere, in the furniture. I did not know that, and I did not know that I was basically, I'm a slow metabolizer of formaldehyde. So it was a journey to figure this out because, the regular doctor doesn't know about it. So we had to really dig deep and understand what was going on with me. And so through this journey, we discovered that, maybe it's more than only me that has this sensitivity to formaldehyde, and we discovered that about 10-15%, depending on your background and where you were born, and you might have this slow metabolizer. But guess what? You might be also a slow metabolizer of alcohol and so many other things. So it is very crucial to know your body, look at your symptoms, not ignoring them, not just saying, okay, let's take this pill to feel better, but deep down there is a root cause disease that is working and you are not aware of it.
So this is the point in your life where you understand that I have to get well, not just physically, which you had a serious lung infection, you had like serious problems. It was also affecting your psychology, you said, your body, and you are looking at it and said, okay, whatever path to cure I'm choosing, it needs to take into consideration my whole body, my whole being, my psychology, how I fit in the environment, how I make choices in the environment, right? And so that's when you discover lifestyle medicine, which looks at people and life in all these ways and kind of brings them together and gives help to all these ways. And as you were talking to me about this, and you're going to talk to us about it a little more, I'd like to share that I've also had a very serious immune disease that kept me in bed and pretty debilitated for a long time, from 2020 onwards, for like 4 or 5 years. And I also tried everything, and I have great trust in our medical system, and also like meditation and vitamins and holistic and massage and Ayurveda. And I'm looking at it as slices of, you know, well-being that can help me. Like medicine helped me, but only that much. And meditation helped me, but only that much. Homeopathy, Ayurveda, they help me only that much. And the pie gets complete when we take also the inward journey, like to understand inside us, to work with what is inside us, to just like go deep, as you said, go deep in the root and try to like embrace all parts of ourselves, to come to terms with life and to just do the best that we can in every slice of our life.
Absolutely.
We also say, you know, in the philosophy that we teach, you know, with yoga and holistic well-being, we also say that there is one energy, one power of awareness in the whole universe that permeates, that creates, that breathes through the flowers, through the plants, through the trees, through the sky, through us, and that all layers of ourselves, they're this one energy, this one awareness. So we cannot just heal one part of ourselves and forget about the other. Everything has to come into the picture. And that's where you and I really agree on. And tell me how you look at it as a doctor.
So, yes, look around you. What you see is people are feeling sicker and they are lost. And I think it's the over-information that everybody has access. It's the overabundance of things that they want to do and they have to do. In lifestyle medicine, we make it simple. Okay, we give you autonomy, which is the number one for me tool to make your own decisions about your health. I will empower you with scientific information, but then it comes down to you to take that information and apply it into your life, your lifestyle.
I guess I saw you working here in this retreat that we had with like real medical needs. And I see that what you're doing is, as a doctor, you do a whole assessment period, which takes at least 2 hours, 2 to 3 hours, and you assess the person with also the medical exams, the blood exams, everything. You have a complete picture. And then once you look at the person from every angle, then you help them to understand their life and how they can improve different facets of their life, right?
Yes, exactly. And I'm going to tell you that based on my assessment, for example, from yesterday, number one in each person's assessment was purpose in life. And you never hear about that in a medical setting. But in lifestyle medicine, we really look deep into your whole being. You are not just your blood work, but you are also your thoughts. You are also your soul. So we look into that in a specific way. It's not easy, it takes time, but we make it simple.
You make it simple, and also what I like about what you described is that you give tools
Yes.
for all these areas, and you recognize that there's 6 pillars, right?
Yes, we have 6 pillars in life medicine. It's nutrition, mostly plant-based. I also call it earth-inspired food. It is movement and continuous movement, as you know.
Walking, running, swimming, doing yoga, Tai Chi, anything that helps people to just move.
Just move, because we have forgotten about moving in life, and a still water is not healthy. So a still body, we are 70% water. So imagine if we don't move. So movement is one pillar. Then we have stress management, and I've said that before. Stress is not bad. It's how we manage the stress, how we react to the stress. Without stress, we would be dead. But that if we learn to live with this stress, with the tools that we will give people, they will thrive.
So it's the point of view. It's how you look at, like, there's a circumstance that is stressful in my life. There's this happening, and I think there's like no way out, but it's to relax, to be in our center, and to see creative ways of dealing with the situation that are not detrimental.
Exactly.
And you give specific techniques and tools for
Absolutely.
people to kind of shift their point of view and to face stress in a
Yes.
like in a more manageable way.
Yes, absolutely. So that's the third pillar. And then the fourth pillar is positive social connection. Very important, how we connect to other people. And we all need help with that. There is no way that we can do it alone, because alone we tend to look at things in a certain way, and we need to unblock that. So positive social relationship. Then we have alcohol, substance abuse,
yeah.
different things for different people. We look at that in a holistic way. For example, I'm going to give you an example. When people come to me, they say, "Oh, you're not going to take the alcohol away from me." And I say, "No, I'm not going to take anything away from you. There is no way I'm going to take anything away from you. But let's look at why you are drinking. What is it, the drinking, what is it offering you that other things can't offer you?" And so we look in it in a holistic way. I'm not just going to take away your smoking, your alcohol, but this is how we're going to understand why you are doing what you are doing.
And I guess what you said that kind of stayed with me is that you've had patients with serious problems when you were working in the United States, and here, starting again your medical career, working with people who have like cancer, diabetes, and overcoming diabetes, overcoming cancer, overcoming serious diseases, just like you did. And that what you understand is that the one element that helps them is how much you care and how much you're there, and without being critical, but just really it's your love and support that carries people through, that helps your patients to feel empowered to make their own decisions, and to know that, okay, I'm doing this for my own good, and I know that I have support, and I will make it.
Yes. You know, one simple thing that I think is missing from all of us is that feeling that I have somebody at my corner who is knowledgeable, but also can support me when I'm at my lowest. And this is what got me through life, and this is what I want to do for my patient, being that support. Yes, I have studied a lot, I know a lot, but at the same time, I can be your friend in this. I can be your accountability partner in this. And this has been, I think this is a missing crucial part for every patient going through difficult times.
I like that, the term that you used, accountability partner, and I've never felt I've had wonderful doctors in my life, caring doctors, but like to feel about your doctor as if they're a partner, a partner, an accountability partner, that, that's also part of the winning formula, right?
Yes, absolutely.
And then we forgot, or we haven't gotten to the sixth pillar, one more pillar, which is sleep.
Oh my God.
And sleep is so important, right?
Yes, restorative sleep, indeed, very important. And again, I want to give a tip about sleep. Don't stress about your sleep, okay? I see that many times. We think we don't have enough sleep, we don't get enough sleep. And in my assessment, many times this comes up that they get enough sleep, but they have so much stress about sleep that they don't sleep. So it is one of the most important pillars in lifestyle medicine, and we can work on that to improve your sleep, to make it restorative sleep. So yes, sleep.
Sleep and how everything comes together.
Yes.
And of course, people can practice and work on their health and work on embracing themselves with care, no matter where they are, whether they're here, they're in the city, they're in Athens, they're in New York, wherever they are, right? And so you work with people also long distance, and you support people wherever they are. But we're saying that to have a pause so that we can start our life again. We can kind of like erase the board of habits and start new habits. This is an ideal environment. You're coming back with a retreat, and we're going to try how it is to live here. This is already happening here. Anyway, when the first retreat you came to, it was for us a yoga and Pilates retreat, and you heard us talk to the group and with the group, and we were eating great food, we're exercising, we're thinking positive, we're supporting each other. Stress is like not an issue here. Everybody here started to sleep better, and we said, you know what? We don't need the alcohol, we don't need, anything else to be happy. And you said, okay, like, my 6 pillars are already happening in this retreat.
Yes, indeed. I mean, I'm going to say it again. This is the ideal place for bringing the reset, as you said, a life reset, where you're going to come here and learn about the 6 pillars. But learning is not enough. Having the information is not enough. We're going to apply it for you. You're going to see how it is in action to eat good and cook good, and the ingredients and the good ingredients, what are they? And then we're going to teach you stress management tools, because you're going to go back and your child is going to scream, and you're going to be your boss is screaming. So we're going to give you the tools to take with you and apply it in real life. And I think the application of things, we don't have a information deficit. We have an application deficit. I think that applying in our lives is what we can help people to take this knowledge and be able to apply it even when they leave from us, because this is what works for my patients, the application, know how they can apply what science says and what traditional way of living and being healthy and healed says in their daily life.
Exactly. And that I like the metaphor. We don't have an information deficit, we have an application deficit. And what stops people from applying is like, they don't know how simple or how doable it can be. Like you need to move. When you're working all day with your computer and your phone, it's, you need to move. So it's very simple to just get up and just go out and just go around the block, or go out, in nature, wherever you are. Just move, just move. It's so wonderful. But in order to do that, something needs to shift in our thought. And we need to understand, okay, it's vital. If I stay and work, I'm not going to be so efficient. But if I take a break and go for a walk for 10 minutes or 15 minutes, understanding how the brain works, how the whole nervous system works, so that when I come back after the 15-minute walk, I'm more efficient, and in the remaining hour, I get a lot more done.
Yes,
right?
absolutely. Absolutely. And really finding what works for their lifestyle to put that in, it's crucial. And when we talk to people, when we sit down with them, they get the information, but then they look at their own lives and say, okay, this is how I can apply it in my life. I'll do it. I'm going to go and do it.
Yeah.
I'll do it for me because I'm going to feel better. Look at me. I feel so much better in one day. So I'm going to take it home with me and I'm going to do it there.
Exactly. And when you make up your mind about it and you make it a priority and it's clear, there's clarity about what you want to do and the reasons why, then your coworkers support you, your boss supports you, your family supports you, because they know it's clear for them because it's clear for you.
Exactly. And exactly what you are saying, the path, when you know the steps, it's much easier. You are not confused, you know where you are going, you have your GPS set, and you know the steps, and you got the map with you, you take it with you, and you just follow it. So you will get to your destination, which is, for me, true health and thriving in your own body.
Yeah.
What is you all about, what you are talking about, it's thriving, thriving, thriving.
Yeah, exactly. And also the fact that this is what we're here for. We're here to help each other to thrive. We're here to connect, to combine, your medical knowledge, your life knowledge, your life experience, and our love for bringing people together and helping them to feel supported, to be like in their best way possible. And, we're here. We're available. We're available also for any discussion, any questions that may be there. More and more, we're going to be available through, wherever we are, but also through internet, through Zoom, through classes. And so, stay with us, and we want you to thrive. We want you to feel supported. And everybody's going through challenges, difficulties in our life. We're going up and down all the time, but just know that there is way, there's a simple and straightforward way, and we're here to support you in that. We're here to support you to thrive. We're here to support you to be your very best self with yourself and with everybody around us.
Yes, let's stay connected. We are here for you, and really thank you for being here with us today.